Okay, Ohad Hershkovitz here again. So this is the second video about OCD. In this one I'll be talking about the cognitive therapy and treatment. Obviously there's different treatment protocols and a lot of them focus more on the behavioral, for example, exposures. But in this video I'll just talk about the cognitive. So as I mentioned in the last video, the mechanism which results in OCD is the judgment or criticism or poor tolerance of the presence of uncomfortable thoughts. And so that's what sets off the desired result, or rather the resulting behavior of trying to fight those thoughts with compulsions, but in the process only giving them legitimacy and creating that negative loop. So what we want to do is we want to break that cycle by challenging the judgment or criticism of the presence of those uncomfortable thoughts. So a big focus of the cognitive therapy is to examine with the patients what it is that they tell themselves about the presence of anxious thoughts, of aggressive thoughts, of the emotions that result from those thoughts, or if there are emotional expressions of behavioral impulses. Maybe when they had a thought, an aggressive thought, they also felt a behavioral impulse to act out on it, even though they didn't actually do it. How do they respond to and evaluate the presence of those thoughts? So as we ask this question, we want to examine with them where do we find the presence of judgment and criticism and lack of tolerance for those emotional expressions. And then obviously we would want to challenge those negative evaluations. So for example, if a patient were to say that the presence of a thought such as I want to hurt my child is a dangerous thought or a forbidden thought or a bad thought to have in any way, we want to examine with them why is that such a negative thing, because that negativity causes them to respond with fear of that thought. So obviously it's an undesirable thought. It makes us uncomfortable. We wouldn't choose to experience it. But on the other hand, why is it a dangerous thought? Why is it a negative thought? Why is it a forbidden thought? Those kind of criticisms only create a negative cycle, whereas calling a thought undesirable but acceptable, or uncomfortable but tolerable, or otherwise not ideal but non-threatening, might cause a reaction of either sadness or of mild discomfort, but not provoke a fight or flight response of fear or anger, thereby exacerbating the thoughts. If they were to focus more on the emotional feeling because it's uncomfortable and I shouldn't be having those feelings, then we'd want to challenge that type of assertion. Why would you expect not to have negative feelings? Isn't life filled with emotions? Some of them are uncomfortable. Does that mean something's wrong? Does that mean that we will actually do something just because we feel it? Have there been situations where you felt uncomfortable and it was fine and you tolerated and it dissipated? Did you have emotional impulses, behavioral impulses, but you didn't act out upon them because you knew that that's not a healthy thing to do, so you were able to tolerate those impulses? And if so, why is it wrong to have a behavioral impulse? So these are just a few examples where we would want to challenge the cognitive evaluation and the negative value that they prescribe to the presence of those various emotional thoughts, physical sensations of emotion, or behavioral impulses. Obviously, it's okay to check with them if there's been situations where just the presence did cause some sort of objective problem. For the most part, at least in my experience, I haven't run across situations like that. I will admit that I don't have much experience with forensic patients or with psychotic patients, so I'm not going to make too big of a generalization, but for the vast majority of patients suffering from OCD, those thoughts and physical sensations and behavioral impulses don't actually relate to real-world risk, danger, or damage. So we'd want to challenge their assessment on it to provide objective reasons and proof why that's wrong or dangerous before labeling it so and causing that secondary fear response and that negative cycle. So that's the main focus of the cognitive challenge in OCD, and trying to help the patients come to better terms with the presence of those thoughts and saying, I don't like it, it's uncomfortable, part of me is scared of it, but objectively speaking, I can't and I won't choose to say that's wrong or it shouldn't happen or it's dangerous. So that's the prime focus of the cognitive therapy. There's other parts as well, for example, self-esteem, which is important because the more self-esteem we have on an emotional plane, the less we are threatened by our emotional thoughts. And so I may talk about that in a separate video. So once again, feel free to ask questions or make comments in the video below. And again, if you're not seeing this on the CBT Nest site, feel free to join our community of therapists on CBT Nest at social.cbtnest.com. See you in the next video.